Many people in your care will need your help to change positions and maintain good body alignment. Helping people to reposition themselves and ensuring good body alignment are major responsibilities of the nursing assistant. Some people only need a little encouragement to change their position and be checked to make sure they're in good body alignment. Other people, however, such as those who may be confused, weak, frail, or in pain, or paralyzed or unconscious, will need more help from you. To check the alignment of a person who is lying in bed, imagine a line starting from the person's nose, continuing through the person's belly button, and ending between the person's feet. The line should be straight, and when a person is sitting in a chair, the person's back and buttocks should rest against the back of the chair. The feet would rest flat on the floor, or the footrests of a wheelchair, and the knees should be level with the hips. Many people have this tendency to lean to the side or slump when they're in bed or sitting in a chair. To help the person maintain good body alignment, you may need to support parts of the body with rolled towels or pillows. We're going to talk about some basic positions that are used in the healthcare setting. A person may be positioned in a certain way for a procedure or to make an activity such as eating easier and safer. People who are unable to change positions easily on their own will have an individualized schedule for repositioning. This schedule will be part of the person's care plan. The schedule uses a sequence of positions that we're going to cover in just a minute to ensure that no single area is under pressure for too long. This is essential for reducing the person's risk for developing pressure injuries, which you just learned about. In the supine position, the bed is flat. The person is on their back with the head supported by a pillow. A small pillow or rolled towel is used to support the small of the back. The person's arms are extended at the sides with palms down. If the person's arms are paralyzed or weak, they should be supported with small pillows. The person's thighs extend in a straight line from the hips. And if the person's feet tend to roll outward, rolled towels or pillows can be placed against the outer thighs to keep those legs in alignment. A footboard may also be used to keep the toes pointing upward and prevent foot drop. But be sure to remember to keep pressure off the heels. A small pad may be placed under the person's calves and ankles. In Fowler's position, the person is in a supine position, but the head of the bed is raised 45 degrees to 60 degrees so that the person is pretty much sitting up in bed. Fowler's position should only be used for short periods of time, for example, when the patient's eating in bed. Leaving a person in Fowler's position for too long puts the person at risk for shearing injuries because the person will tend to slide down in the bed. Fowler's position also places a great deal of pressure on the person's tailbone, which can lead to a pressure injury. The side-lying position, the person is lying on one side with the head supported by a pillow. The lower arm is positioned so that the person is not lying on it, and the top of the arm is supported on a pillow, much like many of us might sleep like at home. A blanket or towel is placed along the back to keep the person in the proper position. The bottom leg is straight and the top knee is bent. A pillow is placed lengthwise between the lower legs to support the knee and ankle and prevent the legs from resting on each other. The Sims position is an exaggerated side-lying position that's used for procedures such as taking rectal temperatures or giving an enema. In the Sims position, the person is almost lying on their stomach. The head is turned to the side, the top of the leg is bent at the knee and supported by a pillow, and the top arm is bent at the elbow, with the hand near the face and supported by the pillow. The bottom leg is straight and the bottom arm is positioned so that the hand is near the person's hip. Make sure the person is not lying on their arm. And then the last common position is the prone position, where the person lies on the stomach with the head turned toward the side. The head is supported with a small pillow. The arm the person is facing is bent at 90 degrees, with the hand placed palm down near the person's head. The other arm is extended straight along the side. A folded blanket or small pillow is tucked underneath the person's lower abdomen or pelvis to give the person's chest room to expand when they breathe. A pillow is placed under the person's shins to raise the person's toes off the bed. The prone position is not used often because many people find it uncomfortable. If the prone position has been ordered for a person, or if the person prefers that position, ask the nurse to help you assist the person into that position. Now stay tuned to apply what you've learned about how the body functions to identify risk factors for pressure injury development.